What non-GERD conditions do diagnostic tests uncover? If you have been experiencing symptoms that seem like gastroesophageal reflux disease, you might be curious about what else could be going on. Diagnostic tests can reveal a lot more than just acid reflux. Let's break down some of the non-gastroesophageal reflux disease conditions these tests can uncover. One common finding is esophagitis, which is inflammation of the esophagus. This can happen due to infections, allergic reactions, or even injuries from medications. These conditions can mimic gastroesophageal reflux disease but need different treatments. Another important condition is Barrett's esophagus. This occurs when the lining of the esophagus changes due to chronic acid exposure. While it is linked to gastroesophageal reflux disease, it carries a risk of developing into cancer. This is usually found through a biopsy during an upper endoscopy. Speaking of upper endoscopy, it can also identify a hiatal hernia. This happens when part of the stomach pushes through the diaphragm into the chest cavity. A hiatal hernia can worsen reflux symptoms, but it is a separate issue that may require different management. Esophageal motility disorders are another area that diagnostic tests can reveal. Using esophageal manometry, doctors can measure how well the muscles in the esophagus are working. Conditions like achalasia and esophageal spasms can cause chest pain and swallowing difficulties, similar to gastroesophageal reflux disease. Impedance-pH monitoring is a test that can detect non-acid reflux. This means that even if acid levels are normal, other materials can still cause symptoms. This test can also help identify functional heartburn, where symptoms occur without actual reflux. Endoscopy can also find esophageal strictures or rings. These are narrow areas in the esophagus that can make swallowing difficult. They may develop from chronic acid exposure or other causes. Lastly, while rare, diagnostic tests can uncover malignancies such as esophageal or gastric cancers. These conditions can present with symptoms that overlap with gastroesophageal reflux disease, making it essential to investigate further. Understanding these non-gastroesophageal reflux disease conditions is vital for both patients and healthcare providers. It helps ensure that the right treatment plans are in place. By identifying these issues, healthcare professionals can tailor treatments that go beyond just managing acid levels. This approach can lead to better long-term health outcomes for those living with gastroesophageal reflux disease.